Good afternoon, everyone, and thanks for joining our virtual presentation from wherever you are. This event is part of the Frank Islam Athenaeum Symposia series. I'm Dr. Fiona Glade, Dean of Communication Studies, English Language for Academic Purposes, and Linguistics. On behalf of Germantown Campus Vice President and Provost Margaret Latimer, and as the curator for the Athenaeum series, I'm honored to welcome you all today. And with deep respect, I gratefully acknowledge the native peoples on whose ancestral homelands Montgomery College sits, as well as the diverse and vibrant native communities who make their home here in Montgomery County today. This distinguished speaker series is made possible through a most generous gift from philanthropist and civic leader, Mr. Frank Islam. A powerful philosophy created by Mr. Islam drives the Athenaeum Symposia. He said, if you conceive it, you believe it, you can achieve it. That really speaks to the kind of transformative education that we believe in here at Montgomery College. You can find more information about our program and view recordings of previous speakers by visiting the MC Athenaeum website. Our presentation today is being recorded and will be available on the website soon. This year, our speakers are all exploring the very timely theme of advocacy, activism, and public engagement. In today's presentation, two brilliant scholar practitioners who are part of the archiving team at the National Library of Medicine, which itself is part of the National Institutes of Health, take us on a deep dive into how important events that impact us all, such as the current coronavirus pandemic, how those events take their place in the historic record. Following that presentation, we'll have time for Q&A. Please feel free to post your questions in the Q&A area or in the chat. Before we go on, I would like to take a moment to recognize the work of a few great folks here at the college who've contributed to making this event happen. Ms. Kaylin Nguyen, who coordinates the admin, our technology experts, Mr. Stan Jones and Mr. Daniel Swirch, and our Athenaeum Fellows from Germantown campus, Professor Katima Lee and Professor Amanda Miller. And now I am absolutely delighted to pass the mic to Montgomery College's own Director of Library and Information Services, Ms. Suzette Spencer, who will introduce our distinguished guests, Dr. Speaker and Ms. Moffatt.
Thank you, Fiona. Good afternoon, everyone. My name is Suzette Spencer, and I am the Director of Library and Information Services here at Montgomery College. As a librarian by profession and having the distinct pleasure of working closely with health science and nursing faculty and students at my previous institution, I'm honored to introduce our speakers. On January 30th, 2020, as the World Health Organization declared a SARS-CoV-2 disease, COVID-19, a public health emergency of international concern, the National Library of Medicine began collecting web and social media content, documenting the emerging health crisis as a part of its ongoing global health events, a web archive collection. In this talk, historian Susan Speaker and archivist Christie Moffatt will talk about the basics of historical research in archival collections, both physical and digital. They will discuss the scope of the COVID-19 project, some of the content captured from websites, blogs, and social media, collecting criteria and methods, and related COVID-19 collecting efforts by other groups. They will also reflect on their own experience of chronicling this pandemic while living through its far-reaching effects of everyday life. Christie Moffatt is a member of the federal staff of the National Library of Medicine, National Institutes of Health, serving as the program manager of the Digital Manuscripts Program in the NLM History of Medicine Division and chair of the NLM Web Collecting and Archiving Working Group. In these roles, she is involved with digitization, and access to 20th century historical collections in science, medicine, and public health, and web archiving of topics and events related to NLM collecting interests, including global health events, Ebola outbreak, Zika virus, and COVID-19, HIV/AIDS, and the opioid epidemic. Moffatt earned her MSLS from UNC Chapel and a BA in history from the University of Georgia. Susan Speaker is a federal historian in the History of Medicine Division at the National Library of Medicine, part of the National Institutes of Health. Along with her work on the NLM web collecting team, she has conceived, researched, and written historical narratives on a variety of scientific and medical history topics for NLM's Profiles in Science Archival Digitization Project, written blog posts on NLM's historical collections, and conducted and curated oral history interviews. Dr. Speaker received her PhD from the Department of History and Sociology of Science, Technology, Medicine at the University of Pennsylvania. Please give a virtual round of applause for our invited speakers, Ms. Christie Moffatt and Dr. Susan Speaker.
Thank you. So hello again, and good afternoon to all. Again, I'm Christie Moffatt. I'm an archivist at the National Library of Medicine in the History of Medicine Division. And again, I'm joined by my colleague, Dr. Susan Speaker, historian of medicine, also at the National Library of Medicine. Many thanks to Dr. Fiona Glade for this invitation to speak as part of the Frank Islam Athenaeum Symposia series. And thank you all for attending this talk. We appreciate the opportunity to share a bit about web collecting at our library with a focus on our work to collect and archive content documenting the COVID-19 pandemic, as well as to reflect on the important themes of this series this fall on advocacy, activism, and public engagement. On this slide is a rough outline of what we'll be talking about today. So we're going to give you a bit of background on our library, collecting history at the National Library of Medicine, how the historical record is changing and research methods too. We're going to give you an overview of NLM's COVID-19 web archive, and a little bit about collecting during this time, what it's been like in our approach. We're going to show you where you can find NLM's web archive collections and also where you can learn more. And Susan's going to get us started with a bit of background, which we hope will give you some context for our current work. Thank you.
Thanks, Christie. Okay, if you don't know much about the National Library of Medicine, we are, as we've said, part of the National Institutes of Health, and we are at the south end of the main NIH campus in Bethesda. We go all the way back to 1836 as an institution. Up until the mid-1950s, we were actually part of the US Army as the Army Surgeon General's Library. We are currently the world's largest biomedical library, and we serve researchers, publishers, librarians, educators, healthcare professionals, and members of the public. If you've ever used the PubMed databases of biomedical literature or the Medline Plus consumer health site, you may be familiar with us. We have a lot of historical material ranging from the 11th century all the way to the present. Our oldest item in the history collection is an Arabic manuscript on gastrointestinal diseases from El-Razi's comprehensive book on medicine, which dates back to 1094. If you want to know more about the History of Medicine Division, you can go to the library's main site, and there's an Explore NLM tab, which will lead you to History of Medicine. History of Medicine Division has been part of the library for all of its history in one form or another. We have a staff of librarians and archivists and historians who collect and preserve historical materials that are related to health and disease. We make them available to researchers, and we interpret them for diverse audiences through various digital projects, exhibitions, and so on. Since beginning our COVID-19 web collecting project last year, Christie and I have done a number of interviews with journalists who are interested in how the pandemic is being chronicled. And we've come to realize that while many observers, probably almost everybody, recognizes that the pandemic is a historic event, some are a little bit fuzzy regarding the roles of historians and librarians and archivists. And some of you might be a little fuzzy about this too. So to start, we'd like to talk a bit about what historians do, what librarians and archivists do, and how these are different, if often related, activities. Historians write, this is a brief description, write about past events and lives, seeking to tell the stories of what happened as accurately as possible and using as wide a range of source material as possible. They assess the existing evidence, they balance different accounts of events, different perspectives, and this includes reading a lot of background in earlier historians' work on this subject, whatever it is. I think done properly, history is an interpretation. It's a synthesis. It's not merely an assembly of dates and facts. If you've only got an assembly of dates and facts, then you've got a timeline, you've got a chronicle, but it's not yet history. So what constitutes the historical record, the evidence, the sources that historians draw on to tell their stories? Well, traditionally, for most of our history, traditional materials for historians include government, legal, military documents, personal and professional correspondence, diaries, journals, records of institutions like hospitals or organizations like labor unions, business records, paintings, photographs, and sometimes popular periodical material like newspapers, magazines, and advertisements. Now note that for much of history, these were the records that were generated and kept by social and political elites rather than ordinary people. And not surprisingly, most histories up until maybe a century ago focused on those elites. Historians refer to this as great man history, and it was implicitly understood to be great white man history. As in the quote that you might come across sometimes, history is made by great men, sentiments like that. Beginning in the early 20th century, though, other types of sources emerged: film, audio recordings, then audiovisual recordings. And these helped historians gather and access the voices of people whose stories had rarely appeared before. People like former slaves, factory workers, farmers, and so on. And the field of history itself began changing during these years, not just because of the expanding resources, but as more historians moved away from great man history and explored the experiences of other groups in society. And in the past 25 or 30 years, more documents, records, correspondence, news sources, all of this stuff has moved to digital environments. And we've also developed all kinds of new communications possible through websites and social media and so on. Now we're going to circle back around to this fairly shortly here, but hang on. How do researchers access all this material? It isn't enough to just save the material. I mean, anybody who's had to clean out 50 years worth of saved stuff in a relative's basement knows this. Collections need to be organized and cataloged. For a collection of books, for example, every item is assigned a record number within a group of items on a similar subject, and this will determine where it goes on the shelf in the collection space. But each item also gets a catalog record with author, title, publication date, relevant names, keywords, lots of other information, so that the library can keep track of what it has and users can find the items in the catalog. Collectively, these kinds of details about the item are called metadata, and this is a term that will be cropping up here. Some of you may be all too familiar with metadata. Certainly anybody in library sciences knows the term very, very well. Librarians do this for books, journals, audiovisual materials, mainly published stuff. There are also some librarians who specialize in the organizing, cataloging, and preservation of very old and rare published books and manuscripts. Archivists are also specialist librarians, but they do the same thing for collections of non-published or original materials. Things like personal or professional papers, letters, notebooks, diaries, journals, photos, maps. You get the idea. When they acquire a collection from an individual or an organization, archivists organize it according to archival standards. There is a prescribed way for organizing big collections of papers. In this process, they will transfer the items from the original cartons and folders to special preservation quality folders and boxes. And they do this because the original containers might be worn or dirty, or they might contain various sorts of litter. And I'm not making this up. You would not believe some of the stuff that comes in boxes of people's papers. Candy wrappers, gum wrappers, keychains, and very weird stuff like used Q-tips. I'm not making this up. Archivists will also take care of any fragile items that they find. For example, placing tattered letters in plastic sleeves to protect them, or photocopying newspaper clippings that are getting all brown and crumbly. They then write up a detailed inventory of the collection, which we call a finding aid. And this describes the organized collection for the users. And like books, archival collections are assigned catalog records with title, dates, relevant names, subject terms, and all that other metadata. Archives are often sections within libraries, although some, like the National Archives, are standalone institutions. And by the way, indulge me with my pet peeve for just a moment here. A lot of the time people describe archival research as, consulting the dusty old tomes in the archive or in the repository. And there are all those movie images, of the kind. You've got this intrepid explorer like Indiana Jones blowing half an inch of dust off the ancient volume in the forgotten library corner. Forget about that. Modern archives, at least the ones with decent operating budgets, are very clean and they're climate controlled, because preservation means keeping the dirt, the heat, the humidity, and the bugs or the mice away from those precious documents. I know it's not as romantic. It's kind of boring, but really, dust is not part of the picture for what archivists do. So, this is the basic framework that evolved for collecting and organizing and preserving materials so that researchers can find them and use them. And it works really well for traditional materials. However, the nature of the historical record has been changing very rapidly, as we noted earlier. And increasingly, the primary historical materials, websites, blogs, online news, social media content, are generated online and they don't exist anywhere else. That's an extremely important point here. They don't exist anywhere else. These are not the materials that will turn up in somebody's attic 50 years from now. I mean, if you want to study the 1918 flu pandemic, which has gotten a lot of attention in the last couple of years, you can still get most of what you need in physical form at some archive or other. But it won't be possible to write the full historical account of the COVID pandemic without using born digital materials. Now, in many ways, the volume and variety and richness of these sources is really wonderful. I mean, historians have never had this kind of stuff to work with. It's really great. And the historical accounts drawn from them will certainly include a lot more voices and perspectives. But there's a catch here. What if that material, like the website and all the content it links to, changes every month or every week or every day? What about the blog or the interview that somebody keeps for a year and then abandons? Websites and web content change all the time. We all know this, and they can disappear without notice. It turns out that the digital content can be fragile and it can be ephemeral. And fortunately, several early internet pioneers, notably Brewster Kahle, recognized these vulnerabilities and established the Internet Archive in the 1990s, specifically to preserve the content of websites before they could disappear into the ether. They developed software that institutions could use to add websites to the Internet Archive collection and more software to keep it all organized. And this is what NLM's web archiving team is doing. We are collecting and preserving born digital source materials related to public health events and issues within the scope of our institution at NIH. Over to you, Christie.
Sure. Thank you. So yeah, what is in scope of the National Library of Medicine? What content are we interested in collecting and preserving for future researchers? You can see here quite broadly, NLM aims to collect and provide access to library materials, importantly, regardless of format, that record progress in research and biomedicine, the practice and teaching of medicine, how health services are organized, the development and implementation of policy, and those that illustrate the perception of medical practice and public health. So it's not a stretch to see how the topic of the pandemic touches many, if not, it touches all of these collecting goals. So what is web archiving anyway? So the International Internet Preservation Consortium, which is a group representing national and academic libraries around the world, defines web archiving as the process of collecting portions of the World Wide Web, preserving collections in an archival format, and then serving those archives for access and use. So the goal here to collect, preserve, and provide access is consistent with our goals for traditional analog materials, for all our historical materials. To collect the web, and this is where it gets different, organizations use crawlers, so these are robots or spiders, in our case through the Internet Archive, to identify and capture content that belongs in a collection based on the URLs that we select as starting points for the collection. These are also called, these starting point URLs can be called seeds. Web content is preserved in a standard format. It's called a WARC file. And web archiving, it's an activity carried out by libraries, archives, and even some individuals, and has been going on since the mid to late 1990s. The Internet Archive is celebrating its 25th anniversary this year. So why archive the web? As Susan describes, web and social media are a significant part of the primary historical record of this time. It's the way we communicate and engage with one another and how organizations get information out. These resources reflect the record of scholarship and historical perspectives. They reflect changes in society and technology. And as already mentioned, the nature of web content is highly ephemeral. It's changing all the time and can disappear without warning. This is also very different from traditional analog materials. We've all seen 404 messages. This is known as link rot. We've also noticed when content at a URL that we remember being there changes significantly. This can be called, sometimes called link drift. So future access to this content, so these are the primary resources of our time for research and understanding of the past, depends on the actions that we take now in real time to identify and collect web content before it changes or disappears entirely. So the National Library of Medicine is taking such action through the work of its libraries, through our library's web collecting and archiving working group. We began with a pilot in 2009. We're an interdisciplinary team of librarians, archivists, and a historian, and our work is broadly guided by the library's collection development guidelines. The tool we are using to collect web content is called Archive It, which is a web archiving service of the Internet Archive. It's a tool used by over 900 organizations across the US and around the world to harvest, build, and preserve collections of digital content. And so while the Internet Archive itself is capturing a significant amount of content broadly across the web, through Archive It, institutions like NLM are able to collect more deeply in their specific areas of interest. We're also experimenting with a few other tools as part of our approach to collecting the wide range of dynamic web content. Since the beginning, so since 2009, we've collected over 10 terabytes of data. And at this time, data is stored in Internet Archive data centers with plans to bring the copies to the National Library of Medicine as well. Our pilot collection was a collection of health and medicine blogs, which aimed to collect blogs reflecting a wide range of roles and perspectives in health and medicine. So since this time, we've developed additional thematic and event-based web archive collections, including on global health events, which is a broadly focused collection, including content from documenting the 2014 Ebola outbreak and the Zika virus outbreak of 2016, and now collecting on the current coronavirus pandemic. We developed collections of content on HIV/AIDS, and the opioid epidemic. And then just last month, we released a newly developed collection on September 11th, Health Effects and Policy. We're also using Archive It to archive our own National Library of Medicine websites.
Yeah, our group, sorry. Our group began collecting around the coronavirus disease outbreak, as was mentioned earlier, in January of 2020, pretty much as soon as the World Health Organization declared the epidemic a global health emergency, or as the official term was, a public health emergency of international concern. We had planned to continue collecting for the duration of the epidemic, as we had with our previous infectious disease collections. We didn't yet know, of course, that SARS-CoV-2 would reach pandemic levels because, let's face it, this hadn't really happened since 1918. And we didn't really anticipate that it would still be wreaking havoc nearly 2 years later. In fact, the very first month, I think we began this, we had a number of discussions about just what to call the disease. I mean, was it novel coronavirus? Was it COVID? Was it SARS-CoV-2? Was it something else entirely? But that resolved itself pretty quickly. Anyway, we've been identifying, as we do for all of our collections, a wide range of web content for the collection, trying to document a broad variety of perspectives on the responses to and the impact of the pandemic. We realized at the very beginning, again, with any health event that's experienced by a broad swath of the population, there are many, many ramifications. It's not just about the person who gets sick, you know, it's about their family, their employer, their job, how people in aggregate behave when threatened by an infectious disease, and requirements for trying to limit that disease. So we knew that we were going to have to look far beyond the actual disease itself if we wanted to get all the interesting stories. And again, as with our other collections, we supported our selection by developing a list of key topic areas and keywords to guide our review of the sources. And we revise these as we're going along, because this is a moving target. We also wanted to note very quickly that this digital content collecting effort is not all that the National Library of Medicine is doing to collect on the COVID pandemic. The library is also collecting other types of material, such as posters and videos and art books and manuscripts. The working group's focus is on collecting born digital content shared on the web, and in many cases, only on the web. And these efforts are in line with NLM collecting goals on a number of topics, including public health, disaster management, history of medicine, popular literature. And as we have worked, we have engaged with many people and organizations who are also collecting on this topic in museums, libraries, and other archives. Likewise, we've also sought internal input from NLM's disaster health librarian and the infectious disease subject matter expert, and more broadly from across the library and from the Office of NIH History. And we've also welcomed external suggestions through blog posts that we share on the History of Medicine Division's blog Circulating Now, and in a few other strategic communications.
All right, so on the next few slides, I'm going to share, include several examples of what we are actively collecting. So here we've been capturing the COVID-19 web pages of federal agencies responding to the pandemic, including the CDC, weekly since the end of January 2020. Capturing this content on a routine basis serves to document the evolution of the official response to the pandemic as we learned more and more, and communications about it. So on this slide, for example, is our first capture of the CDC site on January 29th, 2020, describing how the CDC was monitoring an outbreak of a virus, still, as Susan said, called the 2018 novel coronavirus, that it was identified in Wuhan, China, and that it had been identified in some cities in the United States. In this capture of the same page a month later, we can see the title on the page changing to adopt the official name of the virus, so COVID-19, and information on the site for specific audiences, including businesses and health departments, and what we knew about symptoms and the status of testing at that time. In this capture from late April 2020, we see major changes in the design of the site to make more prominent and easy to find content on how to protect yourself, what to do if you're sick, as well as information on wearing cloth face coverings, cleaning and disinfecting. Businesses were starting to reopen, and other important guidance. Skipping ahead a little bit, so this is almost a year later, March 2021, we can see the marking of the 1-year anniversary of the pandemic, as well as information about what fully vaccinated people might be able to do now. We also captured some of the special guidance shared for holidays when families and friends would normally be planning to get together. These events, as with many of our traditions, as we all know too well, were greatly disrupted. So this is from Halloween of 2020. In addition to the federal government sites, we're also collecting the COVID websites and pages of US states and territories, like this site from New York State. So in this capture from April 2020, we see guidance for non-essential workers and schools, which at that time had extended their closures to May, and requirements on social distancing and masks. We're also collecting select city and county web pages in hotspot areas, like this page from King County in Washington State, the location of one of the earliest outbreaks in the United States. Collecting broadly across federal, state, and local governments will serve to document how different agencies at different levels communicated to the different audiences, and how strategies, like for example, the many different vaccination campaigns we saw this year varied across regions. We're also aiming to document the broad impact the pandemic has had on individuals and groups, including how the pandemic is affecting populations and groups differently. We're collecting the websites of organizations sharing resources to those who are experiencing homelessness, addiction, as well as sites specific to those with conditions or diseases such as cancer and HIV. We've also tried to document the creative uses of technology that have been used to communicate with a broad range of audiences about vaccination and preventing the spread of coronavirus in the US, including Dr. Fauci's recent conversations with TikTok stars, Dr. Francis Collins, our director, trying to teach us all about hand washing on Twitter, and the use of WhatsApp to communicate information in Spanish about finding a vaccine. We're also collecting personal narratives, such as this effort called Pandemic Perspectives, the COVID-19 Journal for Medical Trainees, which has served as a platform for medical students, residents, and other health professionals in training to express their thoughts and share reflections about the pandemic. The organizers of this project actually reached out to NLM to include their site in our collection to ensure that it would be preserved in an archive. You know, it really has been quite remarkable to see how many people recognized the importance of this time in history and documented and sharing their experience. Personal narratives are also documented in the many news stories from across the country that we've collected as part of this effort. Susan mentioned before, we have some keywords. This slide shows our growing list of keywords that we've been using to identify content. So our team aims to document the experiences of patients, nurses, journalists, public policy researchers, scientists, and more. Members of our group meet weekly to discuss new topics and collecting areas as the situation evolves. As Susan said, it's a moving target. It was, we started with, closing down to slow the spread, to testing, masking, vaccine development and distribution, reopening businesses and schools. As everyone really knows, the pandemic is, the story of the pandemic is evolving all the time. So far, we've archived over 10,500 resources, nearly 3 terabytes of data. This is much bigger than any of our other collections in duration and in size. We continue to identify and recommend new content, review that content for inclusion in the collection, conduct crawls, review that captured data for quality and completeness, and then we're adding descriptive information to support discovery. So as with the analog format Susan described earlier, description is an important part of the process of making our resources findable and usable in research. We do notify creators of more personal content of our intent to crawl their material and provide a means for anyone to opt out of inclusion of their content in our collection. And while we continue to focus on collecting, we are building connections with content creators who are interested in having their material archived in their material in our archive, as well as researchers who are beginning to reflect on this past year. It's really been a learning experience in every way. And we're paying attention to indicators of use of our collections, and we're learning about experimenting with tools for researching this collection as data. We're working really with the understanding that the research value of this web archive collection is going to grow over time as researchers look back on the actions and experiences and impacts of this pandemic on our country and around the world. In addition to building NLM's own collection, we're also participating in a broader international collecting effort led by the International Internet Preservation Consortium. Libraries around the world have contributed, and the collection is publicly available also in Archive-It. You can see there is content representing 142 countries and 67 languages so far. And I mentioned earlier our engagement with the museum, where we mentioned we are engaged with the museum, library, and archive community. We are working with others involved in COVID-19 collecting across NIH, the Department of Health and Human Services, and the federal government, including the CDC, through participation in a federal web archiving interest group, the National Digital Stewardship Alliance, the Society of American Archivists, and many other Archive-It partners. We've also been participating in meetings with curators led by the National Museum of American History. There are so many there really are many collecting efforts around COVID-19 across the country and around the world. And this is not just the web, but objects to oral histories, much more to document the community response and experiences of this pandemic.
Yeah, historians are going to have so much fun with this collection. I mean, well, it's not a fun topic, but boy, is there going to be a lot of stuff. But there are some ongoing challenges and questions that we'd like to touch on while we're here. While we've got this great opportunity to collect at a higher volume than ever before. I mean, the web is huge and getting bigger all the time. And from a wider range of perspectives, there are a few caveats that researchers need to be aware of when considering collections of web material. Across all of these various web archiving efforts, the approaches to collecting may vary widely in terms of scope and depth and volume and quality. Some of these differences relate to, individual groups or institutions' mission. Sometimes it's a matter of, staffing levels and other resources. Also, some collections on the Internet Archive are public, but archivists also have the option to make them not public. Along with this, the little crawlers or spiders that we send out to gather stuff don't get everything. We also have to keep in mind, and this is kind of important because I think we tend to think that, everybody's out there on the web, all of them, all the time. We have to keep in mind that not all perspectives are on the web, that some will not be documented or shared for a wide variety of reasons. These might include technical barriers, opportunity, or just the personal choices of the creators. I mean, it's hard to imagine sometimes, but not everyone wants their pictures, comments, stories, and so on all over the web. And so there is a chance that, some of those stories are not going to survive. But that's always happened anyway. And web archives, like all archives, are never perfect, and they're always incomplete. It's important, I think, for us to help researchers understand these limitations as they are working with and interpreting the web material in our collections. There are yet other questions, of course, about who makes the decisions about what to save and whose histories are preserved. To address that, again, we've aimed to broaden the selection process. We all have different ideas about what's important to save, and I think getting input from inside and outside our institution and our group has been really valuable throughout this process. Selecting and saving current content in standard formats is the first big step toward long-term preservation. But we also have to ensure good stewardship of the collections by storing them in repositories that are committed to ensuring long-term access. It's one thing to collect a lot of stuff, even with all of that complicated metadata, but stewardship requires both planning and a financial commitment to things like personnel, because digital archiving is still labor intensive. You still got to have the people to do it. And also a financial commitment to digital storage space and maintenance. These are things that, are always running behind the scenes, but when you use the web, you're not aware of any of this stuff. Okay, so before we get into the Q&A, we wanted to share that you can access NLM's web archive collections in Archive It at the URL here on the screen. And you can also archive them through Internet Archive's Wayback Machine. And records of our collections and links to them are also in NLM's library catalog.
And I also wanted to share that you can learn more about our work in the history of medicine. Division's blog, again, it's called Circulating Now, which includes posts about our related collecting efforts in the division, and actually a post by one of our researchers. Also on this list are links to an article that Susan and I wrote last summer about the collection for the Journal of the Medical Library Association, and then a few really nice articles by others on the value of collecting around COVID-19 for future historical research. And then last but not least, absolutely, I wanted to acknowledge the members of our team who have been working on building this collection while also experiencing the pandemic personally. So, not only was the content sometimes challenging, but, the size and scope too, and the fact, we're all living through it ourselves in different ways. which is very different from previous collecting efforts. So trying to be objective, but also kind of coping with our own knowledge and fears, sort of the uncertainty of it all. We were all, all of us have been impacted one way or another. So yeah, just experiencing the event ourselves as individuals, but also as staff in an institution that's actively involved in the response. So thank you all for your time this afternoon, and we do look forward to your questions, and there's an email here. Please do feel free to reach out with any questions that you have at any time, or recommendations for content. We're still taking recommendations, so you can use this email if there are organizations or efforts that you think might belong in the National Library of Medicine's web archive as we've described it today. We'd love to hear from you. Thank you.
Thank you again. I'm gonna close up now, first of all, by saying thank you once more to Dr. Speaker and Ms. Moffatt, also to our faculty fellows, and to all of you who attended today. A big thank you for participating in the conversation. Our next Athenaeum event is scheduled for 9 November. It's our annual collaboration with the Paul Peck Humanities Institute, and it will be the Bella Myshkinsky Memorial Lecture. This year we're hosting Mr. Doran Isaacson from the Anti-Defamation League. I look forward to seeing you then, and thank you again for supporting the series today. Good afternoon, and stay safe and healthy, everyone.